If someone has PKU and they're not treated starting when they're a baby, they will have brain damage. So I'm very interested in developing medications for people with rare diseases like phenylketonuria or PKU, and trying to have medications so these individuals aren't restricted in their diets for their entire life. PKU is an enzymatic defect in our bodies. So what happens is these individuals have 2 copies of the PAH gene, neither of which works correctly, and so they can't properly break down protein. We figured out that if you restricted a person's natural protein intake and gave them supplement for the other components of protein, they could have normal development. We started looking for PKU by newborn screening, and every baby born in the United States is screened for PKU, hoping that we will get them on the special diet by 2 weeks of life. And when we have a person on the special diet, we can avoid the brain damage, and they can live a relatively normal life, with the exception that they cannot eat foods like other people. So for example, normal people need about 60, 70, 80 grams of natural protein a day. Some people who have PKU are restricted as low as 2, 3, 4 grams of natural protein a day. Andrea Price is a patient of mine who has PKU, who I've taken care of since she was a young teenager. And I first met her at PKU camp, and since then we've developed a very close relationship. Andrea is now in her late 30s, and in the interim time she's gotten married and had several children, and I've been really privileged to work with her during all that time, and she brings her babies in to meet me, my grandpatients. That's lots of fun.
Dr. Northrup she's not more of a doctor, but more of a friend to us. Within the PKU world, in the whole medical team with genetics, you have a different relationship. It's not your typical doctor-patient relationship, because they get to see you grow up and all the differences that you experience just from having to eat different things and not experience what you would say a normal life. But they're there through everything that you go through, all the way from adolescent to adulthood. They're there to experience that with you. So Camp Fever is a camp for kids and their siblings with PKU. And I was a camper in '97. I was 10 years old. And that was my first time at an actual summer camp where I was surrounded by other people with PKU.
The opportunity came for a clinical trial to give what we call an enzyme substitution for the protein, the enzyme her body can't produce that makes her have PKU. And she was in our clinical trial for a drug that's now called Palynziq, and she contributed to trying to get that drug approved by the FDA. And the drug was approved in 2018, and she utilizes this drug and is on a much less really unrestricted diet now.
It's a fun, interesting to be in your adulthood trying new foods for the first time, and people are like, what, you've never had steak? And so they get to share that with you as well.
I think it's really important for us to realize that our entire social system in this country revolves around food. And if you can't participate when the group goes out to celebrate a birthday or a promotion and eat and drink like other people, you're ostracized, and it's very difficult, very lonely. So for these individuals who can now go to a restaurant with their family or friends and eat like everyone else, it's really quite wonderful. I think the future is very bright. In addition to Palynziq, there are now other therapies that we have in clinical trials, some that work in different ways than Palynziq, and I think over time we're going to have the best personalized medicine for every PKU patient available.
Growing up with PKU, I really came to a strong conclusion that I wouldn't be who I am today if I didn't have PKU. You grow a lot of resilience to maybe taunting or teasing about the circumstances that you're in, and it's normal to you, but it may not be normal to others. You get the opportunity to really educate about PKU and not so much let it hurt you or be down about it, but taking the positive turn and really just educating everybody about it, because you're so rare. You've got to do your part and educate people.